Thank you, Chair. Conference, I just want to take a few moments today to flag up the new rollout of the new universal credit system and the issues that are around it. Universal credit is a single payment system which covers the formal benefits of job seekers allowance, ESA employment and support allowance, income support, working tax credit, child tax credit and housing benefit. Around 312,000 households in Northern Ireland will be impacted by this change, the biggest to any the working age benefits in 70 years. The Department of Communities estimate that 126,000 households will be on the average £39 worse off per week with universal credit. The experience of communities in England and Wales where universal credit is already fully operational is that it pushes families further into poverty, causes problems with payments of private rent to landlords, and focuses people to pursue onto food banks and payday loans. Universal credit began to be rolled out already in September last year. Limit Valley was the first one where it was phased into. The phased approach will continue through this year right up until the end of this September. Although some changes have been made to the original scheme, they are too little too late and still leave a fundamentally flawed system, part of which operates on a loan basis rather than a benefit entitlement. Of course, the DUP and Sinn Féin ducked our responsibility and kicked proposed welfare cuts back to Westminster, and now they have the cheek to shed out crocodile tears about the impact of ordinary people. It is very important that the party members have an understanding of the universal credit system, how it works, what it involves, and the impacts that it will have on the lives of people on benefits, in work and in rented accommodation. That is why the party's business committee have agreed to hold an information and awareness session for party members after Easter. The sessions will be based on the Citizens Advice Northern Ireland training materials and will allow members to familiarise themselves with the nuts and bolts of universal credit and to discuss the implications. I myself have personally attended one of the Citizens Advice Northern Ireland training sessions, and it came very highly recommended. I would urge all members to avail of the awareness sessions when they are being held, particularly party members who intend to stand as candidates next year in next year's local government elections. Thank you, Conference.
I'm going to actually go on a wee history. We've been doing a bit of history today, so let's actually continue that thing. Cast your mind back to the 5th of July. Some of us may have been born then, some of us may not. But the 5th of July, 1948. And any of you who will have read Bevan's book on In Place of Fear will actually know the background of this having happened. And it was a piece of legislation, and it was unique in itself because it did not actually have the usual civil servant gobbledygook. It actually meant what it said. And it purely and simply said that from the 5th of July 1948, men, women and children, rich or poor, regardless of circumstances, will have access to free health care, dental care and eye care, free at the point of entry for a national health service. And it's important to remember that, and to remember the backdrop when that came in, because it came in on the back of the war, the Second World War, when Britain at that stage was bankrupt, there was homelessness, there was poverty, there was unemployment. And a progressive government voted in by a lot of the ex-fighters, servicemen that were still abroad, voted in Attlee, a Labour government, because they no longer found it acceptable that they would be sent to war and that they would come back actually to the same conditions in Britain. So that was the start of the National Health Service. At that stage, home health were introduced as well in order to help mothers who had more than one child. And we've been on a journey since. Tories of the day and the capitalists of the day opposed the inception of the National Health Service. In fact, the doctors refused at one point to sign up. And you will remember what Niall Bevan said when he was asked, how did you get the doctors to come in to the service? And he said, I stuffed their mouths with gold. It was as simple as that. And I'm sorry, but we continue to stuff certain categories of people within health and social care. We stuff their mouths with gold and we deprive the rest of things. And indeed, not all doctors come in because GPs sat outside the health service. And I think that's one of the fundamental flaws with the health service as it currently exists. The GPs sit outside it as independent contractors, yet actually they're a big part, and they have a big part of the healthcare budget. So the party believes that we need to bring those in, that there are other things that need to change, but one of the fundamentals is that everyone doing work for the health service is an employee of the health service. That way we stop the fragmentation. And then if we leap forward to the 80s, we had Maggie Thatcher, and she decided that it would be a wonderful idea to create a series of trusts and health trusts. And this all came on the back of competitive tendering and everything else. And it wasn't just actually to fragment the health service she done that. She also done it so that she could lower the terms and conditions of those staff working within the health service. Because trusts were given the right to sell off assets. These bodies were given the right to sell off public assets. They were given the right to set their own terms and conditions. So the rot started there. We then sort of leaped forward another decade, and we had Northern Ireland deciding that that was a wonderful idea. At one stage we had 4 health units, district health units, and we had a board. We had 4 boards, and we had a department. We then got in the Act and we created something like 27 trusts. In Northern Ireland we had to sort of get more as usual than our fair share. So we had 27 trusts, 27 individual trusts. We had still 4 health and social care boards, and we had the department. In 2009 we then had another restructure, and we had 5 health trusts, an ambulance service, a health and social care board, and a public health agency. Well, the parties always supported the concept of a public health agency. So we were lumbered with that, and we still have the department. And it's worth mentioning that not one of these restructuring ever dealt with the fundamental problems within the health service, because a lot of it was about culture and the way people worked, etc. And all they done was make it worse and drag money out of it. It was millions. We used to joke within the service, I wonder whose birthday it is. Are we due another restructuring? Because we believed, actually, those on the ground believed that this was a way of getting senior officers out with more than their fair due, getting them wee payoffs. And I say that actually half tongue in cheek, to be perfectly honest. The 2007 scenario that we now find ourselves in, that's what we're left with. We've got those 5 trusts. We have a health and social care board that costs us £28 million a year and doesn't do anything, doesn't add any value to the commissioning process. The party has argued for years that we did not need a purchaser-provider split, that commissioning added no value sort of whatsoever. And I'm not going to actually go into the detail of the last paper we done and delivered in 2014, but it tells you, it charts the history for you of what was going on, about the fragmentation, the privatisation and everything else. And then in 2012, we had the great brainwave of transforming your care. We had a social care chief executive who sat down with 4 other people, and in the matter of 6 weeks came up with a vehicle called Transforming Your Care. And again, didn't pay any heed to changing the culture, consulting actually widely with the public or the unions, etc. And that made another mess. But its real prime directive was again further, thank you, Jerry, further fragmentation of the service and a way to ensure that home care went out of the statutory provision into the hands of private providers in domiciliary care, and that actually all statutory residential care would close down, and that in turn would go to the private sector. Those were the rationales working, and believe it or believe it not, the only 2 points and the only 2 issues that were ever delivered on in Transforming Your Care were those 2 issues. It was job done after that. They created then another 17, by the way, 17 local commissioning groups. That meant locally they could commission whatever the hell way they liked. So we have again this morass that eats up money and doesn't really do anything. Now the party has always said, and as far back as last year, last October, last November, we were addressing all of the health boards on the latest rounds of cuts, and we were saying quite clearly there was no need for this. But we did accept and acknowledge that there was a need actually for reform within the health service. That the health service as it was in 1948 is not the health service, I mean, sort of now, because things has moved on. But why I started off with 1948 and the poverty and the homelessness and all of that, you know, in many ways you can see a rationale for why that was happening. We are now in 2018 and we have got poverty, we've got homelessness, we've got health inequalities, you name it, and we have got it. And health inequalities in Northern Ireland have not actually changed one iota since we got our devolved administration. In fact, what they have done, and some of it has come out today by using PFIs and sort of every other sort of means and ways, they have made the service that we've got worse. They have taken money away from direct patient care, and they have farmed it out to the likes of the accountants in Ernst Young, I mean Price Waterhouse, you name it, and they have done it. And they have done it to us time and time again. And no one has called halt to that. Now, the party has been said, and we've said it all along, that what we need is proper reform of the health service that delivers actually for all of its citizens, not just the tiny few and not just the handful. Now, in order to do that, we need a process that's open, honest and transparent, that actually allows us as political parties, that allows trade unions, and that allows service users to be part of growing what it is we need. I've got no problem, nor has the party, any problem with actually the use of new technology, etc., or indeed any innovation that they bring to the table. But what has to happen is we need a service that cherishes the original views of why it was set up. We need to cherish Bevan's vision, and that was a vision. It was a vision that there would be cradle to the grave health care provided. Now, I'm going to end on the war note, because at this moment in time, in 2018, there is a war. There is a war being waged on our class. Austerity is about class war. What is happening in the health service is about class war. It's about ensuring the weakest, the most vulnerable, the poor and the needy do not get the services that they're entitled to because someone higher up the food chain has wasted, I nearly was able to say squandered there, has wasted the resources that was meant to be about bettering the health, care and well-being of our society. Thank you, comrades.